Today, we're going to be talking about stuffy noses. Now, we've all been there, haven't we? Whether or not you've got a nagging cold, maybe you've picked up a virus, maybe you've got allergy symptoms, maybe you've got sinusitis, and you feel like you're all bunged up, you can't quite breathe properly, you've probably got sore eyes, and you'd love to know what you can do about it, wouldn't you? So keep watching to find out. Right, first things first, the basics. I'm not going to spend long going over this because I think you already know it. Make sure you're drinking enough fluids, stop smoking if you're smoking, take painkillers if you need to, avoid allergens, so things that might be making any allergy worse, and do try and get plenty of rest. So that's the basics. Now, what about the good stuff? What's things that I recommend to my patients that they can do to help their stuffy noses? Number one, cleanse those sinuses. Now, I think this is the most important thing, which is why I'm putting it as my number one. And this is to clean out your sinuses. Now, you can either just go to the pharmacy and buy a little pot of like saline solution that you sniff up your nose, but I think it's more effective to make your own nasal douche. That's what it's called. And you've probably got everything you need already at home in your kitchen. So what I think you should do is get a pint of cool boiled water. Now, it is important that you boil it beforehand, because if you just use regular tap water without boiling it, that can have bacteria in it that can then cause a bacterial sinusitis and make things much worse. So don't do that. So cool boiled water, and add into that a teaspoon of salt and a teaspoon of bicarbonate of soda, or you might call it baking soda. Mix that together. Then you can either just get clean hands and hold it in your hands and sniff it right up your nose, or you can get a syringe and pop the syringe, kind of aim towards the back of your nose and push the syringe with the fluid into the sinuses, both nostrils. Or you can use what's called a neti pot, which you combine. It's like almost like a tiny little teapot that does the same thing. And you sniff that up. The point is, whichever way you want to do it, you're getting loads of irrigation. So you're washing out all the sinuses, clearing out all the gunk and the debris, getting it all back out. So make sure you're kind of leaning over a sink when you do it. And that should hopefully make you feel decongested, feels like your airways have opened up, feels like you can breathe again, and hopefully feels less uncomfortable. So that is my number one thing to do. And it's also brilliant to do number one before you move on to number two. Number two, tame the inflammation. Now, what I suggest for number two is that you use a steroid nasal spray. Now, this can be just bought over the counter, and if you're not sure how to use a nasal steroid spray, or even if you think you know, you might be surprised, watch my 1-minute video on how to do it, and you'll learn the best way to make sure you're getting that steroid nasal spray into all the right bits. And if you do it after you've done the nasal douching, then you know that that medication is getting exactly where it needs to be in the sinuses. And this helps tame the inflammation, helps settle down the sinuses so you feel less congested again. And it's a good idea if you've got allergy symptoms to start using the steroid nasal spray at least a couple of weeks before you expect those allergy symptoms to start. So for example, if you know you're going to get hay fever in June, then maybe start using the steroid nasal spray in May. Option number three is decongestants. Again, you can buy these over the counter, even in the supermarket. I don't usually recommend these, and that's because if you use them for more than a week, they can actually make your symptoms worse, and you get something called rebound congestion when you stop. So you can use them maybe for about 3 to 5 days if you want to try it, if it makes you feel a little bit better, but it's certainly not in my top recommendation list. Number four would be antibiotics. Now, I would say that most people who come to see me when they think they've got sinusitis and think they need antibiotics, when actually very, very few people with sinusitis need antibiotics. It's very rarely due to a bacterial cause. If you have had symptoms going on longer than 10 days, despite doing the nasal douching, despite using the nasal steroid spray, then do go and get checked out in case you're one of the few people who does need antibiotics. But for the vast majority of people, antibiotics won't help your symptoms. What they're going to do is probably give you some diarrhea, disrupt your gut bacteria, lower your immune system, etc. So best avoided unless really needed. Number five is antihistamines if you think there might be an allergic component to it. So for example, if you're also sneezing a lot, you've got kind of runny, itchy eyes, an antihistamine might also help. And number six, there are also just a few other little simple things you can do that may or may not help you feel better, but certainly are worth trying. So you can get, for example, a flannel, run it under some very warm water, squeeze it out, and then kind of push it and hold it over your eyes, over your sinuses. It may just make you feel a bit more comfortable because it also helps that kind of dry, sore eye feeling. So that could be worth a try. Some people like to try eucalyptus oil. That can help act a little bit like a decongestion and make you feel like your sinuses are opening up. Some people do try steam inhalation, but this isn't recommended anymore actually. I think I used to do it as a kid actually. I have memories of leaning over a bowl on the table with boiling water in and a towel over my head. But the reason this isn't recommended, I think, is mostly because of the burns risk. Because if you imagine, if you accidentally tip that bowl of boiling water over you, then you're in much more trouble than you were when you just had a stuffy nose. So best avoided. So that's it. So I hope you've learned something there. So I think there's two things, isn't there, to take away from that. One, do your own nasal douching, and two, definitely use a steroid nasal spray. And I think if you do those two things, actually your symptoms will clear up pretty quickly. So I hope you found that helpful. Do remember to check out my steroid nasal spray video, but also have a look. I've got lots of other videos. I'd love to hear what you think. So please do comment, and I'll try and reply to all of my comments. And do have a look and watch any of my other videos you find helpful. All right then, take care guys.